So let's get going. The Building Community Pathway Practice and Policy, the Shields for Families Plans of Safe Care, and the Community Supporter Pilot Proposal. And we'll talk more about what we mean by all of that. But first, we will introduce ourselves. I'm Michael Williams. I'm the Senior Policy Analyst at the Child Abuse Prevention Center, and I'll hand off to my co-presenter.
Good afternoon, everybody. I'm Dr. Catherine Icenhower. I'm the CEO of Shields for Families, and some of you may also have seen me on the Child Welfare Council and the work I do on the FFPS leadership team.
On the everything you do, Kathy. All right. So our journey today, and I hope it is a journey. We'll have some reflection to kind of undergird it. So hopefully we kind of reach some new thoughts together. But what we're going to talk about is the frame that is coming out of the experience in practice about what it takes to make a community pathway happen, and then go deep into the Shields for Families Plans of Safe Care, where it is happening and where this frame kind of comes from. We'll talk about taking that to scale and how that is impacting current policy proposals and what you can do to help influence those policy proposals. One thing I will say is that this is, and if you've attended 101, you heard this distinction between the community pathway as it relates to family first prevention services versus the broader one more connected to mandated reporting to community supporting. This is the one that is connected to mandated reporting to community supporting. For family first prevention services, that's all about when families do come to the attention of child welfare and are determined to be eligible for prevention services to keep them out of the system and for funding. That's that community pathway. This is the pathway of averting families the whole experience and trauma of being reported to child welfare. So it's all about that alternative infrastructure of support and really trying to make it real. Kathy, is there anything you'd say about anything else you'd say about the distinction or how we want to frame this?
Well, I think just the distinction that this is a community pathway where we want to go. We're starting off in California with looking at how we can get those EBPs up and running. But the intent is to expand to that broader community pathway that Michael was talking about, which is the work that we're doing with the Mandated Reporter Advisory Committee. Again, recognizing that families need a village out in the communities. And so this is going to be talking about, as Michael said, like what we did in order to start to build that village for a specific population, something that hopefully that you can replicate.
Great. And so thinking about what you can replicate, we really invite you to, you can write these down in your notes. We can put them in chat, I think. These reflection questions. We really want you all to think about how can I apply this in practice, at least in how I approach practice or next ideas we move forward with. And so the questions are, what new possibilities are open to our organizations and state to make community supporting a reality? So that community pathway without going to child welfare. So I hope you hear Kathy's presentation. I hope you hear about the policy directions or maybe something you've heard already, not from us today in the convening, about what are some possibilities to do something different to make that village a reality and the government intervention less of a reality. And what can I do to support needed changes, either within my organization or in collaborations I'm part of or in conversations I'm part of. So I hope you listen for ways that you might answer these questions for yourself, and we'll revisit them at the end. I talked about the dimensions of community pathways. So these we can discern from the experience that Kathy's going to share that there are some core things that happen that community pathway, or maybe more clearly, the community supporting that true alternative, that true connection to a village when a family's in crisis and we want to avert child welfare intervention. And they will be organizational and community partnerships, trust building and mindset shifts, especially between organizations and with folks, with mandated reporters, paying attention to staff competencies and clarity of processes, and always the centrality of parent voice. So I'll hand it off to Kathy, who will tell me when to advance the slides as she tells us about the Shields for Families plans of safe care. I guess first to say, so I'm waiting. We visited Shields through the Child Abuse Prevention Center and Strategies and California Family Resource Association, and we're just incredibly inspired by all their work. But these plans of safe care are definitely something completely could be completely game changing, and we're so excited to be involved with it, and it helped inform the policy we'll talk about later. So with that, I will hand it off to Kathy. Oh no, Kathy! Kathy, you're on mute.
Okay, thank you. All right, I'm having a little trouble with this system today. I just wanted to say that I saw the chats about the slides, and we'll make sure that the slides get to you. And hopefully you remember those 4 themes that we just went by, because I think they're all critical to building really the community pathway, or the community supporting that Michael is talking about. Probably most of you know that we have a lot of disparities in our child welfare system. And one of the groups that has historically been the only words I can think of is targeted in the child welfare system, for lack of a better word, is mothers who are struggling with substance abuse. For those of you who know me and know Shields, know how near and dear this is to my heart, because this is exactly the reason why I started Shields for Families many years ago. We were in the middle of the crack cocaine epidemic, and in my community, South Central Los Angeles, literally every mother who gave birth to a substance exposed baby, had their child removed and placed in foster care. There were no resources in the community. There was nothing available other than detention. And that is something that, in my mind, still has an effect on our community, because many of those children never came back home. And our families deserve a whole lot more. Again, substance use alone is not a reason to detain a child. Substance use disorders are a treatable issue, and our mothers can go to treatment. We have many programs now, unlike what was available 30-some years ago, that take a mother and her children into the treatment program. And in actuality, a law was passed in 2016, federal law, that requires hospitals where a child is born substance exposed, or the mother has a history of substance use, to develop it was initially called an infant plan of care. It actually changed CANRA. So this is in CANRA. But as you probably know, in California, this is not something that is happening. In most states, it's something that is not happening. And unfortunately, in that little window of time, when after a child is born, if a substance use issue is identified, then almost 100% of these families have been getting reported to the child welfare system. And we wanted to do something in LA County to address this issue, because there is, in my mind, no reason why these families have to be separated, that there are alternatives available if we can provide the support. But that takes, like that first dimension, like an organizational mindset and community partnerships. Because hospitals, years ago, I used to be a hospital social worker. I understand you have a very short moment of time. Most hospitals are not connected to community resources. Some are, but the majority aren't. And so what happens is, again, these families get reported. you can go to the next slide, Michael. So we were fortunate enough, and I'm going to share this now, but then I'm going to talk to you about all the work that went into this. But now we have been blessed to have a pilot in 5 different hospitals across LA County, where we have navigators on site, which work closely with the hospital teams in order to meet with every single family where there's a child born with a substance abuse issue, or again, a mother has a history of substance abuse, to develop a family wellness plan. And this is very much a strength-based program. And so we help the family put together a plan. They really put it together with what it is that they want and need. And we assist them with linking to whatever services or resources that they need in order to, again, keep those families together. Oftentimes that involves, and again, we've been blessed to have a funding that can support concrete resources for our families. So if there's an issue with rent or, food or a lot of times our moms were finding they have just assumed that their children are going to be removed. And so they have not prepared for having a child at home. So they don't have a crib, a car seat, any of those things ready. And we're there to step in and help them with that support. What is really key is the relationship between the navigator and the family. And again, I'll talk a little bit more about that as we move on. But again, this is what we have now, but it took a long time to get here. So if you can go to the next slide. So partnership, oh my goodness. We've talked, if you were able to be on this morning, you heard a lot of things about trust, about the shift in the mindset, about, all those things are critical. And I think really the key part of this, the collaboration and partnership, the collaborative focused on developing plans of safe care started in LA County in 2021. It took us 4 years to get to the point where we could implement this program. And that 4 years was worth it. And again, back to community pathways. And I think that what is different perhaps this time around, because I've been in this work for a long time, is that we all have to step out of our silos. And for those of you in the audience who are in social services, I'm talking to you also. We have often sat back and said, oh, the hospital is doing this or law enforcement is doing that. It is on us also to step up and meet with those other partners in the community to figure out how we can do things different. And I'm sorry, POSC, that means plans of safe care. I saw the note in the chat. And that is the plan that is developed with the family. We actually have changed the name to Family Wellness Plan. But in the terms of this presentation, I'm talking about plans of safe care because that's the federal program that requires us actually to implement these programs. We spent a long time, and I'll talk a little bit later about the process we went through with the hospitals, but at this point in time, our navigator works directly with the OBGYNs, with the pediatricians, with the social workers who are on staff at those hospitals. And we have a whole process in place in order for us to be notified that a mother is giving birth, and then working with that team in a multidisciplinary way to make decisions about everything, including if a child abuse and neglect report is going to be filed. Our partnership with the Department of Children and Family Services is, I can't give them enough credit. It is really amazing. They have a separate unit of staff that are thoroughly trained on working with this population and the law around plans of safe care. And so they work with us in order to, again, we give them the information showing we can mitigate risk. They help the social workers in the hospital understand the law and oftentimes are explaining to them why they will not be taking a report on this family because we have been able to mitigate the risk. We do notify the department, and this is, again, a part of the law, We notify the department every time that we develop a plan of safe care. However, there is no identifying information that goes with that. It is literally an email that said, we developed a plan of safe care. And there's no name, there's no information at all. But that way the department can meet their obligation to identify how many plans have been developed. If you go to the next slide. So again, building trust and changing mindsets. Like I said a few minutes ago, the LA Plan of Safe Care Collaborative was actually formed 4 years ago. And that was done under the auspices of the Office of Child Protection in LA County. Minson Meeker, who talk about a champion, she is an amazing champion who worked across departments within LA County, our Department of Health Services, our Department of Children's Services, Children and Family Services, in order to build a collaborative group of folks, everybody who might be touched, our substance abuse system, our Department of Mental Health, everyone who might be a part of both the response to these families. And then worked hard to help to move the vision of keeping families together to practice. And that, again, is a major culture shift for most of our mandated reporters that are involved with these families. It has historically been a report that has been the response with these families. And that's, again, across the hospitals, even in other systems, when they show up in substance abuse treatment, it's often the response there. So it has been a lot of work moving that vision from reporting to handing off and wrapping that family in supports in the community. Next slide. So just kind of an example of that, because honestly, even within the hospitals, what we found when we were working with them, that there were very different goals and thoughts about working with these families. That in obstetrics, yes, we want to make sure of maternal health. In pediatrics, we want to make sure that this newborn is safe. Same in social work, but, again, everybody was focused on a different part of the family and not the family as a whole. Next slide, Michael. So this is what we were trying to get to in working with the hospital staff, is that, again, a family, that this maternal infant dyad, that the parent could be in recovery, that the baby can be at home. Really, ultimately, that's what everybody wanted. But there were lots of fears that were involved in that. If you could go to the next slide. And those fears really showed up as we started to work with the hospital. And you can see all of that. Concern for parent relapse, concern for newborn safety, the trauma response, uncertainty over whether or not they should report, whether they were mandated to report. Were they going to mess around with their liability if they didn't report? All of those things were major barriers. And on top of that, as we began to work with each hospital, their policies that they had in place actually supported pulling families apart. We had hospitals that had policies that said that a moment that they knew a child had a mother with a substance abuse history, that child was removed and placed in the NICU, even if there was not a medical reason for that child to be placed in NICU. And so there was, again, those 4 years were spent in a lot of work with every hospital, looking at those policies, agreeing that we all had the same goal, changing those policies, and we literally have a workflow protocol in place at every single hospital. that ensures that on every step of the way that we are all informed, that we all are maintaining that same goal of keeping the families together, of doing everything we can to try and ensure that a report is not filed if possible, and that if it is, that we've still got a plan in place to try and get that family back together as soon as we can. Next slide, Michael.
Kathy, I've got a few questions in the chat for you.
Oh, sure.
The first one says, will they help with medical detoxing? Not sure.
Of the mother?
Yeah, I believe so. Yes.
Yeah, if the mother is in need of detoxification, then yes, we would be working with one of our partners to make sure that they got transitioned to a detox facility, or if they could do it outpatient to ensure that medications are available for them.
Right. The next one, challenges. How do we refer families prenatally so we have time to make a difference before birth?
Yes. Right now, the hospital, we're limited to these 5 hospitals. So essentially, if they go to those hospitals for their prenatal care, we do pick up families in the prenatal, in their prenatal period, and develop a plan with them so that it's in place at the time that the child is born, and can start linking them to those services pre-birth also.
Okay. And then wonderful. My daughter's siblings who are in their 30s and 40s, based on how they talk about how the system failed their mother, will be happy to hear about this. Which hospitals?
Okay, we're in 5 hospitals, which I think is coming up, but we are at 2 private hospitals as well as 3 county hospitals. So we are at LA General, we're at White Memorial, St. Francis, Olive View, and Harbor UCLA.
Okay. And then we have, how long did it take to retrain mandated reporters to report to Shields instead of CWS?
Well, I'm gonna say for the majority of them, it took about a year from the time we started till now. And with some of them, it's still a work in progress. And, that is where the partnership with DCFS has been amazing for us, because the assistant director there at the hotline, Crystal Bolton, continues to come out and educate the social workers and retrain them on a continuous basis, so that they're hearing right from the department that as long as we can mitigate the risk, there is no need to report.
Nice. Do you have, oh, I'm sorry.
Go ahead.
Do you have inpatient programs where moms can keep their child?
Yeah, not Shields directly, but we are partnering with probably 10 or 12 different substance abuse treatment programs that do take mother and the child. And that's where, again, of these pillars, why those partnerships are so critical, because we are talking about a window of a couple days, generally speaking. And so those partnerships are key for us to ensure that that family gets into treatment immediately. And those partners have been willing to modify, talking about, again, modifying policies, modifying the way that they approach their work in order to ensure these families can get directly into treatment. So this is a list also of the staff competencies. And again, just the procedural clarity that is necessary. Like I talked about, the protocols, and making sure that we are following the protocols and that we don't break the process, because again, this relies on us working together as a team with everyone in the hospital as well as with child welfare. And so it is so critical that we maintain that. Can't say enough how much that this, and is a voluntary program, folks. Families do not have to enroll. They do not have to develop a family wellness plan. But they do in order to support themselves and their families. They get, we link them, if they're in our geographic area, we link them to Shield services, and we do have outpatient perinatal treatment as well as mental health and other services. We are able, as I said before, to provide those concrete supports. And one of the things that we have added since we started, you see, we've been doing mental health screenings from the beginning, but one of the things that we've added is a dedicated therapist to assist with assessment and linkage. What we're finding is that a large percentage of our moms have underlying mental health concerns that have gone untreated and been expressed through their substance use, but there's actually underlying mental health issues that really need to be addressed. So if you could go to the next slide, Michael. So again, the parent voice, I can't tell you enough how all of this has really come from our family. It's back from the very beginning. They told us what they needed, and we did our best to try and address that. And I want to say that how I look at this is that we're not trying to fix families, we're trying to fix the system. Our system does not work for these families right now. And so what we're attempting to do is modify the system so that it can support families instead of work against them. And again, we encourage our families to look at their strengths and build on those strengths and identify what their goals are, not what anybody else's goals are, not what the department's goals are, but what their goals are, and some of those change over time. And we continue to follow these families for up to 18 months. And so there is a navigator that is, like by their side this entire time. And, that support and all of our navigators, they are from the community. They are, representative of the families that are in the program, and they are there to really, truly support and walk with them on this journey. Can you go to I think we have the family wellness plan. This is just an example of the family wellness plan. And I will tell you that in the 4 years prior to this starting, there was a group of lived experts who worked with us to help develop this plan. And you will see that it is not, like, we definitely didn't want some dark form. We weren't focusing on, oh, you've done something wrong. This is really focusing on, okay, what is it that you want to do? What are your goals? And if their goal is that they don't want to go into treatment right now, we will support them for wherever they are. If you go to the next slide, you'll see that there's a whole lot of emphasis on their child and, and their baby and planning for their baby. And they fill this out themselves and they get a copy of it. They also, again, get a welcome bag from the program, and just introducing them to, being who they are, great moms. So next slide. So just to give you an idea of what we've been able to do. So on the left-hand column, this is the data from LA County in 2023. There were 824 substance-exposed infants. 98% of them had a child abuse and neglect report filed, and 54% of them were removed from their mother. We've been doing this now, I have the data through January, since March of 25, so not even quite a year. We've developed 177 plans. Only 47 of them, or 26.5%, had a child abuse and neglect report filed, and only 35, or less than 20%, of the children were removed. We're fortunate enough to be able to present a little bit further in LA tomorrow on this program. So those of you who are in LA will have the opportunity to meet some of our families who are doing amazing things with their lives, given the opportunity. You go to the next slide. So going to scale, because of the success that we've had, we are now getting asked by other hospitals to implement the program there. I think, again, like we heard this morning, heard in every presentation I've been in. I think we all want to do the right thing, right? We all want to do the right thing. And that we just have to start looking at things a little bit differently and being more creative about how we approach and how we work with other partners. And sometimes, again, it takes a lot of time and a lot of work in order to make it happen. But it's worth it for our families. And Michael's going to talk about a bill that can potentially help with some of that funding. We've been fortunate enough, if those of you are not familiar, OCAP actually has a grant called Road to Resilience that is targeted specifically to implement plans of safe care. So those of you who aren't on their mailing list, get on their mailing list. And also this is where, again, I think somebody brought up CalAIM. This is where we're looking at potentially implementing ECM and some of the other CalAIM supports as a way to expand and continue to grow this program to take it to scale.
Okay, Kathy, there's about 8 questions
Oh
for
my,
you.
okay. I'll let you go, Stephanie.
Okay, so how do we convince our local hospitals with no shields program in place to refer prenatally?
Well, I think as with any partnership, it takes building relationships. And so if you can find somebody who knows somebody who is connected to that hospital, or else you just go show up at their door. I've been known to do that before. And talk about how you can work together and how what you're doing can help to change some things for them. I mean, I am sure most hospitals are not proud of the fact that their children are removed from their mothers. And so, you saw in those circles that I showed you, that was data from the OBGYNs, the pediatricians, and the social workers. So those were the goals that they had. So, I think that, again, all of us want, to keep families together, but also don't want to put children at risk. And so this provides them with an alternative. So if I can say anything, I'm saying knock on their door, figure out a way, go to your local Department of Health Services, we'll oversee some of the county hospitals, figure out an avenue in.
Okay. The next question is, who checks on the family in the home after discharge?
Our navigators do. Our navigators go out to the homes. And again, we use our partners in the community too. So I want to be, clear about that. So if they are enrolled, for example, in Parents as Teachers or Healthy Families America, then those staff are seeing that family on a regular basis. So it depends on what services they're enrolled in. If they're in our perinatal treatment program, usually they're seen every single day. And so we make sure that we are providing a network of support for all of them. But ultimately, our navigators are available to support them for, again, up to 18 months.
Did you mention if the Shields program is an EBP?
This program is not an evidence-based program. No, not yet.
Okay. And then there's which EBP are you using?
Well, all of our staff use MI. And so that would be the EBP that I would say would be using here as a basis. But there is no specific EBP that we're using here. We're connecting them to evidence-based programs, like I said, to HFA or to PAT. Those are probably the two biggest ones that we utilize for our families.
Did you have to increase staffing in preparation of increase in referrals? If so, how were they funded?
So as I mentioned, this is one of the community pathway pilots for LA County because again, they identified this was a population that was being disproportionately referred to the system. And so Actually, I fought to get get to this program because we are on site at one of the hospitals, St. Francis, providing welcome baby services, which is a first five program in Los Angeles County, and talking about building that relationship. Had a relationship with the hospital and felt like we could work with them to convince them to implement plans of safe care. And so we were able to utilize some state block grant dollars for part of the funding. But we started off with 3 hospitals, and very quickly, other hospitals wanted to join on, particularly LA General, which if you're from LA County, you know that's big county, as some of us call it. And so we have 2 navigators there. We applied for and we're fortunate enough to receive the Road to Resilience grant from OCAP. So we have a combination of those 2 funding sources, but we are also, like our staff are getting ready to be trained with MI, as well as enhanced case management under CalAIM as a mechanism in order to, continue to build on this and add additional hospitals.
Do you have any issues with wait lists for services?
No.
No?
I know that may seem unbelievable, but again, it's about building those partnerships in the community. So our program manager with partners, because this is a first time. Chills has always been primarily in Spa 6 and like the Long Beach area, so South Central and Long Beach. So some of the hospitals are out of the area that we have historically served. And so we've had to do a lot of the job when we first got up and running was to build relationships with the programs in those communities. And so we are part of like the county's home visiting consortium. And so we connected with the home visiting programs that are in that area. We connected with the other welcome baby programs in that area. And then we went really door to door with a whole lot of the perinatal treatment programs to develop and build that relationship with them.
Thank you. So that means your wait lists are not triaged, correct?
We don't have a wait list.
Got it.
Yeah.
ECM navigators is the question. Do you have ECM navigators?
We don't right now, but that is something that we're looking at doing in order to, again, expand into other hospitals. We've got a wait list of hospitals who want to be a part of it.
Oh, nice. Okay. Is it possible for us to get a copy of the Family Wellness Plan document to use as a guiding template while we try to implement this in our community?
Absolutely. There is contained in these slides, but if you go to LA County's Mandated Supporter Initiative website, there is a whole section in there on plans of safe care that will give you the wellness plan. There is also, I didn't talk about it, but a newborn risk assessment that was developed that our hospital staff use, as well as many of the policies and procedures that we have developed that, we want to encourage spreading this. So much of that is there.
Okay.
And if you have any trouble, reach out to me.
Okay, then it says, who was that again? POSC funding through OCAP?
Yes, the Office of Child Abuse Prevention under CDSS.
Okay. And then community prenatal, we definitely. Do you have anyone on your staff that personally used the pilot?
The pilot has only been existing for, a year at this point. And so no one on the staff currently have used this pilot, but there are staff in the program who have used Shield services previously.
Thank you. For the few families where a report was filed with your local CWS agency, what led to making the report versus not reporting the family?
Again, it was situations where we were, for whatever reason, unable to mitigate the risks in the family. But a lot of the time, that's been like the mom identifying that they needed additional supports before they could take the child. And in the majority of those cases, we've been able to place the child with a relative caregiver so that the mother still has custody or still can see the child, I mean.
Okay. Thanks, Valerie, for putting the plans of safe care in the Valeria in the chat. And then the last question, have things not worked out and you did have to refer to CWS? Have things not worked out and you did have to refer to CWS?
Well, I think that was yes. So yes, in about 20% of the cases, we have filed a report and, but again, not stop working with the family. So I just want to make sure that that's clear. Again, sometimes there are situations where there are some safety factors outside of the substance abuse where a report is needed to be filed. But we continue to work with those families again to try and get those children back home and get the mother the supports that they need in order to address those risk factors. So again, we continue to work with every family, whether or not they have their children or not for that 18-month period and longer if needed.
Thank you. That was the last question for now.
Okay. And I want to have Michael have time to tell you another way you might be able to get funding.
Michael, you're on mute.
There it is. So there's a lot of policy stuff on the screen at the moment, but I want to pause for a second just to think through kind of unscientifically the implications of those kind of results. That there are 400,000 allegations of child abuse and neglect statewide. 90% of those do end up being unfounded. So if those unscientifically, those kind of results could be realized statewide, there would be 200,000 families every year who would not be unnecessarily reported to child welfare. And there would be 96,000 families a year that would not have children unnecessarily removed. So this has just such amazing potential impact. As we'll see, there are many inspirations. I had said in the first, the 101 session, the work of Humboldt County on their decision tree has been an inspiration for where we're going with this. And I saw earlier, Deborah Davies, if you're still with us, the LA pilot up in the San Fernando Valley also did similar work around averting child welfare referral. And so the opportunity really seems to be ripe. I'm going to speak a little bit to the policy path from our angle that we saw leading to this, although others might have come to it from different paths, and where we're going with policy and how you can be involved and support. So I'm with the Child Abuse Prevention Center of California. We're the state representative of Prevent Child Abuse America. So we have a presence in Sacramento as the Child Abuse Prevention Council and the backbone agency for the Birth and Beyond Family Resource Center network. And then we also have a statewide presence, partly through our partnerships with All for Kids for Strategies TA, as well as the California Family Resource Association. We support the statewide network of family resource centers, and that's been a focus for our advocacy. Several years back, our past CEO, Sheila Boxley, some of you may know, really had the foresight before a lot of child abuse prevention organizations were doing this to say that preventing child abuse and neglect, especially neglect and especially unnecessary reports, is about supporting families and not about blaming families. So we put our support and we put our policy emphasis behind family resource centers. And really broadly, they're specifically family resource centers are members of the California Family Resource Center and CFRA, but it's those organizations like Shields that provide family responsive, culturally responsive services, community embedded hubs for support. And so a lot of our policy advocacy first drove around, well, what we would do we would take policymakers to visit the amazing family resource centers in the Sacramento area. And one time we took the Department of Finance to see a family resource center, and they said, this is amazing, but if you ever want state funding, you've got to get family resource centers written into state statute. So back in 2018, We sponsored Senate Bill 436, which for the first time in history defined family resource centers in state statute. That's been followed up by federal law. HR 9076 last year defined FRCs in statute federally. So that's going to help expand federal funds that are available to FRCs. And then this year, and I'll put a link while I have the display up, I'm not really able to share links, and I didn't share them with Stephanie, but I will share a link when we get out of full screen here. Senate Bill 557 is updating the state statute. That state definition allowed us to do COVID relief funds and other supports for family resource centers. And we really wanted to build on those to propose state funding, a dedicated state funding stream for family resource centers in the state budget. We put forward budget proposals in 2022 and 23. They both got pretty far and kind of bombed out in the final state negotiations. So we kept refining. We got feedback from the state that we need more definition in our program to get that state funding. So what does that have to do with mandated reporting and community supporting? Well, while we were doing that, we were also involved in supporting the Family First Prevention Services Act, and our Strategies Technical Assistance Program was helping counties plan for the community pathways and the partnerships with family resource centers. And within the Family First Prevention Services Act, it created more federal funding for prevention, but two, it started to define that partnership with community organizations and define what those community pathways are. So you can go back to episode 1 and watch a recording of that to see how that played out. Something specific about them that don't apply to this model is that to be eligible through Family First Prevention Services Act, families need to be referred through child welfare to be authorized for FFPSA services and the evidence-based practices and all the things that involves. And what was happening also in parallel with that, and Kathy has been a great leader for this through the Prevention and Early Intervention Committee, is that mandated reporting to community supporting became more a part of our ongoing conversation. The Office of Child Abuse Prevention funded a policy brief through Safe and Sound, talking about how mandated reporting, the disproportionality of families of color, of African American and Native American families who get reported, the high prevalence of unnecessary reports to child welfare, and the need to create a new path. And the Prevention and Early Intervention Committee of the Child Welfare Council, led by Kathy, as well as David Swanson Hollinger at the time, really worked to say, let's put this into action. And so helped form the Mandated Reporting Community Supporting Task Force, which acknowledged that referral to child welfare is a trauma in itself. And it's a trauma that disproportionately, especially affects African American families, and where half of African American children will have experienced a report to child welfare during their childhood, that this has just been unacceptable. And we know through family resource centers and community-based organizations that supports are out there to make this unnecessary. We just need to, one, support them, and two, provide more definition so folks know what's available. So the task force made a number of recommendations, many that are rolling out through the Department of Social Services, many around refining the training for mandated reporting, so there's more distinction between what is reportable and what isn't reportable. And I have as the next bullet point Assembly Bill 2085 and Senate Bill 1085 did narrow that definition of what neglect is, what reportable neglect is, really saying poverty is not it. If you see a child who is, not wearing clean clothes or looking like they're not getting enough to eat, that is not necessarily reportable. And likewise, it was part of the legal backing that Kathy talked about, that a parent with a substance use issue is not grounds for removal. So the law and the recommendations started to say that. The state is working on policies to improve mandated reporting and make that clarity. And there also needs to be legislation to back that up. And the task force recommended legislation to address the liability issues of the decision not to report to child welfare, to bolster the community pathway and these community supports, and to make clear about what is and isn't reportable. In late 2024, a great champion for this work, Assemblymember Dr. Corey Jackson, introduced Assembly Bill 1799 that tried to make that distinction, and it didn't pass. It got lost in committee, and the conversation in committee was, well, what are families going to get if not child welfare? And how do we know that the child will be okay, even though we don't know the child will be okay for sure if they go into foster care? But they were getting this pushback of, how can we assure that it's quality services? And so that's where these paths start to meet, in that the work we were doing around defining family resource centers, defining how the state should fund family resource centers, is defining what that is. As we've been shopping this around, one legislative staffer said, yes, this is the missing piece. The real concrete, what happens for a family that is in need of supports but not needing child welfare intervention. And it's kind of the same mindset of a mandated reporter. And I'm married to a teacher. I have friends in the health field, and that is, when you're managing your liability, the thinking is, well, I see a family in need, all I know to do is call child welfare, because I don't know what else is out there. And so we really saw a convergence to address this gap, address the gap in policy, address the gap in mindset. And as we were pulling this together, our organization had the good fortune to visit Shields for Families as we were studying this. And again, speaking again to El Nido and the other pilot project, we were learning all about these projects that avert referrals to child welfare. And we really saw it in action and really saw it come to life when we visited Shields. So really, we're in conversation with Kathy, with Casey Family Programs, as well as our own legislative advocate, the Alliance for Child and Family Services, to really come up with an alternative. So I'm kind of mess with my screen here. So here's what the alternative is. And again, I'm going to be putting into chat the text of this bill. This is the legislation we're sponsoring. It's going to the Assembly Bill 2441. I should have put credit here. Celeste Rodriguez is the Assembly member who is the author. It's going to the Assembly Human Services Committee this coming Tuesday. And so if folks are around, some folks are going to be around for the Alliance Conference. If you can be in Sacramento at the state capitol Tuesday afternoon, you can come and sit in on the long hearing, but then come up to the microphone and say, I support AB 2441 as well. I'll talk more about action follow-up in a minute. I'm getting ahead of myself because I want to tell you what AB 2441 is. So it's much like what Kathy described, is piloting the idea of this actual handoff and demonstrating the effectiveness of this community handoff through family resource centers and their partnerships with mandated reporter agencies. And again, I say family resource centers, but the definite, even if you don't call yourself a family resource center, and we'll put the AB 557 up, it's a broad definition. And if you're a hub for families, and if you provide that culturally responsive support, and if you address family protective factors, you may well meet the definition of family resource centers. But for that partnership between the community-based organization and mandated reporter agencies, just like you heard about from Kathy, to cultivate that alternative to reporting to child welfare and build that trust that can build the alternative referrals. It requires endorsement from child welfare, and as you heard from Kathy, it will take great partnership with child welfare to make it happen, because child welfare needs to be confident if you're not reporting to us, something good is, the right thing is happening otherwise. It will involve building on that trust and mindset, building on warm referrals, not just reports, building on closing the loop of referrals, whether there's a statewide closed loop referral system at some point, that's great, but really just confirming and following up, as Kathy described, that the plans of safe care does. And it will define staff competencies for this, as well as share definitions using the standards for family strengthening and support from the National Family Support Network. And it will provide for training. And its evolution, as Kathy described, was happening with plans of safe care, come out of our dialogue with the families that families and family resource centers in our network serve. We had town halls a couple of years ago. We've been talking to members. We've been raising parent voice in a lot of our conversations, and a lot has been validating the direction we're going. And as we structure this, it will have parent voice structured in. That's the community supporter legislation. And so what's next? And I think I'm going to stop sharing so I can first take questions. I know I tossed a lot out, and then also put some of my links in the chat, and then I'll put the presentation up again after that. So I don't know if there are any questions in chat, Stephanie.
No questions. There's a thanks for the shout out, Michael. And then I have another comment from Maria. I think our society needs a real mind shift. When we see a child who looks hungry, dirty, or possibly unhoused, instead of calling child welfare first, we should call a family resource center or community supporter, because that child is experiencing poverty that isn't their fault and they deserve support, not separation from their family. Thank you, Maria.
Maria, so well said.
Thank you, Michael, for putting that in the chat. Any other questions or comments?
I'm messing around with my computer here to make sure I get all the information in the chat.
No worries.
Well, if I can add on, I think this legislation gets to some of those populations within child welfare where, again, we see a high number of families getting referred to the system, not necessarily substantiated reports, but there's an alternative way that we can handle that if we figure out how to partner together, so that those families don't have to experience the trauma of that investigation into their lives. And so again, it takes us partnering across systems, but something that I look at the names out there, I know many of you, and I know you can do.
All
I
right, we
see
have
a
hand up.
hand.
May Ackerman?
Hi, can you hear me?
Yes.
Yes.
Hi, thank you so much for this really helpful presentation. And I just wanted to flag, I work at the National Center for Youth Law. We work kind of across these issues and really think about the intersection between different systems. And my team focuses on commercial sexual exploitation. So I just wanted to highlight that this is a really important place for thinking about how community pathways can work, because, about 10 years ago, we changed the law so that commercial sexual exploitation could be a form of child abuse, so that those young people could be supported in the child welfare system instead of being arrested. But we also know that they do much better if supported in community, and where the family doesn't need to get wrapped into the child welfare system to begin with. So I just want to plant that seed that I think we talked about, babies and how that early intervention can happen. And it's also happening kind of, later for young people impacted by trafficking. And so just want to be planting that seed that this is also a place we can be building on community pathway work and thinking about alternatives to reporting and system involvement.
Thank you for raising that. I think the bill specifically targets like law enforcement and figuring out ways to work again with special populations. So thank you for raising that population as a place that folks can intervene and change the trajectory of those children.
Do we have any more questions for Kathy or Michael? We have about 20 minutes left.
Yeah, we're going to circle back to our reflection questions. I'm going to put one more thing in chat in terms of follow-up. If you are inspired, if you have the authority to do so, well, on behalf of yourself or on behalf of your organization, you'd have to get right on this, because I think it's due at 5 o'clock today. You can submit testimony to the Assembly Human Services Committee at the link I just provided. You have to register yourself as a lobbyist, someone who's providing information. And as I think Yvette noted, I put a link in for the committee meeting. When the committee day event comes up, there will be a link for watching that on video, so you can cheer us on.
And
Right.
sometimes they do allow public comment, although it might be limited. I'm not sure if they will at this one, but
yeah, it's as I understand, and what we usually with this, you are able to, if you can speak on behalf of an organization, you walk up to the mic after the testimony and say, I'm with this organization and we support this. And so there is that option. All right.
Michael, is it too late to sign on to the letter?
It's too late to sign on to our letter. That's been submitted. So we submitted a letter with a whole bunch of people's logos on it, which is kind of customary. If you want to get on our email list, I can put my or notification list. I can put my email in chat. If you're a Family Resource Center, I highly recommend joining the California Family Resource Association, where you definitely will get the inside line for those opportunities.
But I do think you can send letters of support or emails of support to the assembly person who's carrying the bill, as well as those on the committee
Right.
that are hearing it. And so it's never too late for that.
That's right. And assuming it passes committee, I'm trying to get my thing set up here. See, sorry, I'm trying to get in line here, but it's not letting me do it. Okay, hang on. We're gonna get a sorry. Try that again. Assuming it passes committee, then there will be a great opportunity to call your assembly member. Everybody's assembly member will be involved in the decision. It will take some advocacy because it will be there will be money involved. It will be a budget ask. And so we will be in touch. And definitely, if you want to be notified, you can put your email in chat and I can pick it up as well. Okay, I'm going to do another, hopefully not fumble. Well, I didn't see the numbers, 105 folks. Thank you all for being here. I'm hoping.
No, we had a high of 108.
Wow.
And I would encourage folks that are out there. Many counties have not yet utilized their state block grants also, and they're still in that planning process. So if this is something that you are interested in doing, definitely a population that needs some assistance. Can you go back to the first slide of mine?
First one of yours.
Because I need to say one thing. Go.
Yeah.
No, the opposite direction.
I also want to note these.
That's my grandson. I just have to say that.
Oh, your grandson.
He's 21 now. So.
Oh, how cute. These all the like the state capitol picture I provided, but all the rest are from Kathy, and I think most of the rest are from the programs. Actually, the one I love is still coming up, but it just you can see the heart that is going in these. But before we get to that, I want to get to, here's our previously on. I'm wondering if anybody noted these questions, and from what you heard, did you get some inklings of new possibilities that are open to our organizations or the state as a whole to make this sort of community supporting reality? Just if you want to go off mic and say, and people start talking over each other, and we'll start raising hands. But anybody give some thoughts about this, about the possibilities that this makes you think about?
I guess this is Yvette. I'll pop in, and I can just say I'm excited for the possibility for family resource centers to all of them, like you said, Michael, um, ones that know that they're family resource centers and ones that don't know that they're actually family resource centers to work together, at the community level. I think it's really important that to make the change that we want to make for people to know about each other. And so one of the things that I'm going to do is make sure that Shields knows that we're available, those navigators, for a couple of those hospitals if their children with or at risk for disabilities, that they want some special help for those families
Think we've already
with us.
used you a bit.
So we're available, and when I go tomorrow, I'm bringing some brochures and cards so that we know about each other. And I'm hoping that everybody else that's a CBO that's coming tomorrow do the same.
Thank you.
Now, most of you will be meeting with your counties tomorrow. Thanks for raising that, Yvette. Are there possibilities or thoughts about how you can help influence the conversation with your county tomorrow?
So Michael, I can't find my raise my hand button on this, but I just wanted to say I really appreciated this presentation. I loved hearing about what Shields for Families is doing. I recently had a very productive conversation with our Director of Children and Family Services, who was really on board with this. And I feel like that's a real key for us to be able to move toward community supporting in Contra Costa County. So, and she's really open to listening to sort of everybody else's experiences and hearing about what's happening in other counties. So, I might tap into that down the road with Rosalind to see, just to sort of reinforce why and how this could be so helpful to families in our communities and really move toward keeping kids out of our system. And I was going to say one other thing and I just lost it. Anyway, yeah, I think the mandated reporter training that I'm on a committee with that as well, and hopefully that will be rolling out soon. That'll be another tool for us to use to start educating our community about what this means to support families. And so I think we're moving in a really exciting way, and I think that, yeah, it's going to be a lot of work, but we're going to make those changes. We're really going to impact, hopefully, our communities and be really, when we say supporting families, really supporting families. So thank you all for the information.
And Michael, we have a comment in the chat from Maria Cavella. For San Diego, a huge new possibility using our existing strengths, Live Well, the Hope Framework, Family Resource Centers, CalWorks, and peer and kinship supports to create real community supporters that families can turn to before a hotline call is ever made. Our organizations and the state can invest in training and paying trusted community members to walk alongside families and build clear pathways so when someone sees a child in need, the first response is to connect them to support, not separation. Beautifully put, Maria.
Yes, thank you.
Yeah, thanks. And Carol, thank you. I think you're illustrating, I think, what Kathy emphasized, that this is a program model, but really the model is relationships, and you're cultivating the relationships. Our hope today is for folks to have something concrete in their mind, to be in those conversations with their counties and with the mandated reporter organizations to say, oh no, something else is possible. We've seen it. How can we make something like this happen here? And hopefully AB 2441 will provide a boost to a number of communities that will be it'll be 25 pilot projects. So it won't be everywhere, but out of that, we hope it will demonstrate the effectiveness of this approach so that other people can be inspired and other people see a concrete path forward. That is the whole idea.
And Michael, I have a question for you.
Yeah.
I know you said earlier that there are a lot of organizations that did not know that they may be FRCs. Is there an awareness campaign? Is there something that makes them aware that they can be reached to let them know that you are an FRC? So is there anything being done in that light?
The California Family Resource Association is doing it's ramping up a recruiting drive. Our program manager just went on maternity leave. I haven't heard about a baby yet, but so our ramp up is probably gonna be over like later in the year, but you can go to californiafamilyresource.org to get more information on the California Family Resource Association. I think we have links also into the National Family Support Network, which has information on what it takes to start a family resource center. But I would say I am glad to have those conversations with anyone who wonders if they're an FRC, if there's someone in your network who you think is a family resource center, to really think through what does that mean and how can we support that work that's happening. Because we are working on that.
I'll use, yeah. I was going to say, I'll use Shields as an example. We built ourselves from the beginning, just serving families and whatever it is that they needed. And that's how we continue to grow. And I think if you're a family resource center, then you will know that that's because that's your mindset, is that you're working with the entire family and you're working to get them, whatever door they come in, you're working to help them get whatever it is they need. And so, there are lots of agencies like I saw Deborah Davies on the line, Nito. There are many agencies out there that provide those kind of wraparound services. Yes, Yvette, no wrong door. There is no wrong door, and we're going to work with you till we figure out what it is that you need, and we can get it for you, kind of where there's a will, there's a way kind of approach. If that's what you do, you're a family resource center.
And then Marcella says, yes, I was wondering how CBOs can get on that list.
Yeah.
You can join the California Family Resource Association.
Yes, join the California Family Resource Center Association.
And I'm glad you want to, and you can email me, Marcella, if you have some specific questions. Let me know more about what your organization is, and I can tell you more. And we have actually, that's good for the next slide. So, Kathy, I don't know if you were where this picture is taken, and I'm making a lot of assumptions, but that just to me looks like this mom looks like such the face of gratitude. I don't know, she might have been telling the joke for all we know, but in this picture, she looks like the face of gratitude. So I love having this to close with.
Oh, well, yes. I mean, I think that she was probably advocating in this picture, because that's one of the things that I think is, it's not just offering support, it's helping our families build support in their community and learning their strengths and their power, and that they can advocate for services. So, as I said, many of them are coming tomorrow in order to share their experience, in order to advocate for, more services for, other families. And so if they could, they would be at the hearing next week. We just couldn't figure out how to organize that, but many of our families go on to, be very much advocates in this field in order to get other families the supports that they need. And probably, last count, I believe about 45% of our staff are alumni from our programs that have went through our services.